In September 2019, the retail giant known for its everyday low prices launched Walmart Health, a primary care clinic at a supercenter in Dallas, Georgia. The doctor-run clinic, the first of its kind for the big box retailer, offers services like x-rays, annual checkups, and dental exams. With 15 Walmart Health locations up and running as of December 2020, the company announced plans to add at least 7 more by the end of 2021. As consumers face skyrocketing healthcare costs, Walmart, along with its rivals, CVS Health and Walgreens, are diving deeper into the healthcare business, opening in-store clinics in an attempt to grab a slice of the $3.6 trillion Americans spend annually on healthcare. But analysts say Walmart faces several hurdles in its quest to scale up nationally with a roster of highly paid doctors and dentists.
Healthcare is notoriously complex. If you think about the delivery of care, there's so much of a personal touch that's required, and it doesn't lend itself to Walmart-style efficiencies. So there's always been skepticism about Walmart's ability to deliver that high-quality care experience, never mind profitably and never mind at a national scale.
Consumers associate Walmart with high volume and low prices, not something you necessarily want for your healthcare. But with more than 35 million people uninsured as of 2019 and millions more with high deductible health plans, could Walmart Health's low price point be the future of healthcare in America? Sam Walton opened the first Walmart store in Rogers, Arkansas in July 1962. But the company's push into the consumer healthcare space didn't start arguably until the late 1970s when it opened its first pharmacy. By 2019, Walmart had more than 15,000 pharmacists on staff, and its pharmacies offered prescription drugs in almost all of its 4,700 U.S. locations. Walmart opened its initial supercenter in 1988, marking the retailer's first step into the competitive grocery market. By 2001, Walmart was the largest grocer in the country. In 1991, Walmart entered the eyewear business, becoming one of the nation's largest producers of prescription glasses. But as the company grew, it faced internal difficulties providing affordable health care for its employees. In 2008, Walmart had 1.3 million full-time and part-time workers in the U.S., with about 1 million people eligible for healthcare benefits. At the time, only half of its employees accepted the company's health coverage, and about 10% of workers were receiving government health coverage. To increase enrollment, the company expanded benefits and tested new programs. By 2019, Walmart said more than 1 million Americans, including workers and their families, were receiving medical benefits through the company. And Walmart continued rolling out new products and services to attract consumers too. In 2006, with an aging U.S. population relying on Medicaid and Medicare, the company introduced a $4 generic drug prescription program. In the early 2010s, the company rolled out the first of about a dozen urgent care clinics staffed by nurse practitioners called Walmart Care Clinics. The clinic's services included health screenings and disease management of diabetes and high blood pressure. According to analysts, the urgent care clinic initiative was met with mixed results and did not expand nationally. As of October 2016, 140 million customers visited either in person at one of Walmart's 4,700 stores across the U.S. each week or online.
And you look at the specifics of the primary care market, which is where they're competing, it's a very broken market. Pricing is not transparent, customer service is very hit and miss, and in large parts of the country, there's very little access because there's no primary care doctors. So Walmart saw in that a large opportunity to grow the business and serve their customers.
And as Walmart moved deeper into the healthcare space, it faced increased scrutiny from federal regulators too. In December 2020, the retailer was sued by the Justice Department, accused of fueling the opioid crisis in America and unlawfully filling thousands of invalid prescriptions. In a statement, Walmart said the Justice Department's investigation is tainted by historical ethics violations, and this lawsuit invents a legal theory that unlawfully forces pharmacists to come between their patients and their doctors. And the company has made moves outside of its stores as well. As of December 2020, the company had opened over 600 COVID-19 test sites and tested hundreds of thousands of people. And at the end of 2020, Walmart began administering the COVID-19 vaccine to healthcare workers in New Mexico. In addition to being the country's largest grocer, Walmart is also one of the biggest pharmacy chains in the U.S., behind CVS Health and Walgreens. Sales of health and wellness products, which includes pharmacy, optical, and hearing services, reached $37.5 billion in fiscal year 2020, more than 9% of Walmart's overall U.S. revenue. Like its rivals, Walmart has been trying to grab a slice of the $3.6 trillion Americans spend annually on healthcare.
Healthcare seems to be the next frontier in retail. Everyone's trying to get into the act. CVS has been in it since the beginning, but they've been expanding their reach, merging with Aetna insurance, adding primary care clinics.
In 2018, CVS Health bought insurance giant Aetna for $69 billion. Following the acquisition, CVS Health began adding more services to its 1,100 Minute Clinics. The Minute Clinic was launched in 2000 and treats ailments from minor injuries to bronchial infections at a cost of 40% less than urgent care.
Walmart is new to the healthcare space, at least to the service side of the healthcare space. CVS is not. So they've got a brand advantage going in.
In 2019, CVS Health rolled out its new health hubs. The redesigned stores, staffed by nurse practitioners and physician assistants, offered checkups, mental health counseling, and services to manage chronic diseases like diabetes and high blood pressure. By the end of 2021, CVS Health said it plans to have 1,500 health hub locations nationwide. Walgreens is making moves too. In July 2020, Walgreens announced it would include a doctor's office inside hundreds of its stores. The pharmacy chain joined forces with VillageMD to open 500 to 700 clinics in pharmacies over the next 5 years. As part of the deal, VillageMD will staff and run the primary care clinics, and Walgreens will invest $1 billion in the company. An online giant, Amazon, is positioning itself in the healthcare space too. In September 2018, Amazon bought online pharmacy PillPack for $750 million. PillPack ships prepackaged medications directly to consumers' doors. Amazon is also looking to bring down healthcare costs internally. In 2019, the company launched a virtual primary care clinic for eligible employees and their dependents in Washington state called Amazon Care. According to analysts, if successful, that program could expand and potentially be repurposed for the general public. But it's Walmart's leap into the doctor-run clinics that has the healthcare world abuzz. As of December 2020, Walmart Health had 15 locations in Georgia, Chicago, and Arkansas, with plans to add at least 7 more by the end of 2021. The clinics offer services such as primary care, dental exams, x-rays, hearing services, and mental health counseling.
Well, there are several opportunities for Walmart. One is to drive people to its stores. They'll have separate entrances, but you'll use the same parking lot. And if a couple comes, one of them can be shopping for breakfast cereal and the other can be having their annual physical exam. And healthcare is something you use fairly regularly, so it's an opportunity to get you there a fair amount. So on its own, it's a potential revenue source.
According to James Gardner, a Boston-based retail healthcare consultant, Walmart has 3 big advantages over rivals CVS Health and Walgreens. Its prices are significantly lower, the clinics are doctor-led, and it's convenient. 90% of Americans live within 10 miles of a Walmart store. An adult primary care visit at a Walmart Health costs $40 and a teeth cleaning starts at $25, regardless of your insurance status.
They're supporting that with ultra-low pricing, the likes of which the industry has never seen. Access to mental health, for instance, for $1 a minute. That's unheard of.
They will undoubtedly get customers, patients who hadn't even thought of getting health care. They had thought that they were going to get a box of Wheaties, and they realized that they had an achy knee. Why not take care of that while they're here? So it is going to be seen as the high volume, low price provider. But if they can frame it right, that can work to their advantage.
Walmart's health centers are staffed with a range of disciplines, including primary care physicians, dentists, audiologists, optometrists, and mental health counselors. And the clinic will offer walk-in appointments, extended hours, and free parking.
So Walmart promises to change the game potentially in a really interesting way, perhaps changing their reputation amongst public health officials in a really fascinating direction.
For Walmart Health to scale nationally, analysts say the retailer would need to overcome several big obstacles. Over the past several decades, patients have historically had long-term relationships with their primary care doctors, something that might not be consistent with mass-produced healthcare. A recent study found that the number of patients in the U.S. with a primary care physician in 2015 was 75%. COVID-19 may have started to change that. According to the Department of Health and Human Services, telehealth has seen a meteoric rise since the start of the coronavirus pandemic.
I think telehealth is a big opportunity for them. You can then access their services from anywhere. You can supplement it with an in-person visit. You can then supplement it with online shopping for your medications or for other health-related products. I think that figuring out a way to have a hybrid model where you have the bricks and mortar associated with their stores, and then online you can do much of it as well.
Another issue is the potentially high cost of running doctor-led healthcare clinics. Walmart's success is due in part to its army of relatively low-wage workers, something that might not be feasible as it expands clinics nationwide. As of May 2020, the company had about 1.5 million employees in the U.S. The average wage for a U.S. hourly associate was more than $14 an hour. The annual average wage for a family doctor in the U.S., according to the Bureau of Labor Statistics, was $213,000.
To be honest, their ultra-low pricing confounds many. Despite their claims that they have some structural cost advantages, many of us look at the pricing they're charging and the cost of hiring professionals like doctors, optometrists, nurse practitioners, and others. And frankly, we struggle to understand exactly how it's all going to work.
The retailer could also face pushback from consumer groups regarding the sale of products like tobacco and hunting rifles that are at odds with its dual identity as a major healthcare company, as well as concerns over its data collection.
The other piece that they don't talk about that much is data. Healthcare data is protected by the HIPAA law, but there are ways to share it, particularly in de-identified form, that provide great opportunities for mining it and targeting marketing and expanding their offerings. If they can put the healthcare data together with the retail data, they have a powerful combination to get a sense of their customers and how to direct marketing and how to offer the kinds of services and products that are most likely to entice people in.
But despite these issues, analysts say that with millions uninsured and a health crisis in rural America, Walmart Health could potentially be a game changer and open up access to healthcare for tens of millions of Americans.